Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, the shortage in stimulant medications for children with ADHD. Rheanna Platt, a child psychiatrist at Johns Hopkins, speaks with Dr. Josh Sharfstein about the value of these medicines and how the shortage is both hurting families and widening disparities. Let's listen.
Dr. Rheanna Platt, thank you so much for joining me on Public Health on Call to talk about the shortage of stimulant medications for children. And I'd like to start with a basic question. Why do some children take stimulant medications in the first place?
So stimulant medications are really one of the best treatments that we have for a condition called ADHD, or attention deficit hyperactivity disorder.
Tell me about that condition. How does it manifest itself in children?
So ADHD is what we call a developmental disorder, and it can present in several different ways. As you can imagine from the name, sometimes it can present primarily with inattention or attention deficit. And what that could look like is just someone who really struggles to attend to what's going on around them, struggles to stay focused. And you can imagine how that could be a big challenge when you're in a classroom. For other kids, they primarily may appear hyperactive, or the HD part of ADHD. You know, those kids may have trouble controlling impulses. They may interrupt other people, and not necessarily in an intentional way, but that they just may struggle with this. And then some kids present with both types of symptoms, inattention and hyperactivity.
And they can be quite disruptive. It can impair the learning environment for all the kids, but also really make it harder for kids to succeed in school.
Yes, there's the kids who may have trouble paying attention, who just then may tend to fall behind in school. But then you're correct. Sometimes it can be disruptive for the overall classroom. And then, these kids sometimes will really start to become demoralized related to how they present. And then finally, I think it's important to note that for kids who struggle, for example, to control their impulses or who are interrupting, they, can have challenges in their relationships with peers. That's really one of the most important things that kids are doing as they're growing up, is developing social relationships. And so when there are problems with that, we also can see big problems or demoralization.
Now, I remember from my time as a practicing pediatrician, seeing kids with this kind of distress and then treating them with stimulant medications and seeing them really improve. Has that been your general experience?
Yeah, absolutely. So, amongst all of the treatments that we have in psychiatry, and some would say even in general in medicine, stimulants are some of the most effective treatments that we have. Many kids tend to have quite a good response in terms of improvements in both attention, but also in impulsive or hyperactive behavior. The other thing that we see that's not uncommon in kids with ADHD is struggles with regulating emotions. So having a lot of difficulty getting angry really quickly. So we also sometimes will see improvements in that as well.
Is it true that as more kids with ADHD are appropriately treated with stimulant medications, then their chance of dropping out of school actually goes down, and their chance of succeeding in school and going on to do other things goes up?
Yes, that's absolutely true. And then the other thing that we see, you can imagine with impulsive behavior comes things like risk-taking behaviors, right? And so we also see with appropriate treatment of ADHD, what we would call risk behaviors like drug use in adolescence, for example, actually decreases.
So we've got a pretty serious condition and a treatment for it, but these days, it can be hard for parents to find the treatment. Tell me about that.
Yeah, so particularly in the past year, what started off as a shortage of sort of one part of ingredient for one medication and a shortage of one stimulant medication for ADHD has had these downstream effects. And there are a lot of different medications for ADHD. And I think that's actually a good thing in the sense that kids really sort of the rhythm of their needs and their symptoms and the demands that they have are really different. So some kids have more trouble in the morning, some kids have more trouble in the afternoon. And all of these medications are a little bit different in terms of, some of them are controlled release. So some of it is released later in the day versus earlier in the day. And so for a lot of families, they may have tried a couple of different medications, landed on one that worked. And then when that medication is not available, that can be a big challenge. And so this has led to downstream impacts of shortages on multiple types of stimulants.
So patients who have been stable or doing well in school, have friends, are, basically doing the things they need to be doing and enjoying themselves in the process, suddenly lose access to medicines that have been helping them. What happens when that takes place?
So, what we've found is that, they may lose access to a particular medication. Sometimes some pharmacies may have some, others don't. And so, for some families, they may be calling around to different pharmacies and trying to find one that has the right medication versus, ultimately having to take a different medication. It might have been something that they had previously tried that didn't work as well. And then there's others who just aren't able to access medication at all.
It sounds stressful for families.
What my experience has been, it's been very stressful. So there's not been always a centralized way to know. And, on the end of the person who's prescribing the medication, we have a general sense of where there's shortages, but we don't have necessarily a way of knowing in real time if the medication is going to be available. So there's, first of all, a lot of energy that goes along in terms of trying to find a pharmacy that may have the medication. And then for folks in some areas, we hear about people driving far distances, and you can imagine that, for some families, it may be possible to do that, to spend the time and energy and potentially cost of medications. But for others, that they really don't have that to spare.
And so this shortage is not just a problem for individual families, but could be a problem in general for groups of families that don't have the resources that others do in order to keep their children doing well in school.
Yeah. Absolutely.
So what's on the horizon for this? What do you hope to see as you think about policies or practices that could be helpful to you and your patients?
Yeah, I think, in terms of policies, stimulants are a controlled substance, right? And so there's regulations in terms of how much can be produced. My understanding is it seems like there's maybe not as much coordination across folks who are manufacturing and then the DEA. There's a lot of folks involved. So I think some of it is really coming up with a coordinated response that takes into account how critical these medications are and helpful these medications are for some folks.
I've been reading about concerns about overuse of stimulant medications among adults, and the extent to which that is a significant concern we're really not talking about today. But I wonder whether that concern may be driving some controls on stimulants that are actually having an effect on kids. Is that a concern of yours?
Yeah, I do think that's a concern. And I think the other thing is that there certainly is overuse and misuse of stimulants, right? And there are procedures that we have in place for that. And that's part of what's being monitored by the DEA. I also think that ADHD for not a small group of people persists into adulthood and is associated with things like trouble with job functioning, car accidents, things like that. So, I do think what we are seeing as an overuse may also be an increased identification of symptoms in adulthood. But yes, I think, concerns about that then have these downstream impacts on kids and families who really need these medications, because the concerns about overuse then lead to the idea that, well, we don't want to be increasing our production of these medications to meet a demand that doesn't really exist, or that might be like related to overuse, when in fact, I think getting a sense of, is it really overuse? Is it appropriate treatment? But also, what are the downstream effects of those concerns if kids ultimately are not able to access medications that they need?
There's a potential enormous irony here that in the effort to kind of address a fear of overuse of a controlled substance, you're actually undertreating a condition that's associated with the use of controlled substances or the misuse of controlled substances.
Yeah, that's absolutely true.
And, we're talking about kids who are taking medication that helps them succeed in school, stay away from dropouts, stay away from risk-taking activities. And if we're making it harder for them to do so, it's a little bit of cutting off your nose to spite your face.
Yeah, that's absolutely true.
Well, Dr. Rheanna Platt, thank you so much for coming to talk to us about this challenge and what you're seeing. And I hope there's some relief for you and particularly for your patients in the near future.
You're welcome. Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.